So to treat for dry eye, you do have to have a good diagnosis. It's important to be diagnosed properly. I always tell my patients in our office, we do try to determine the root cause of your ocular surface disease. We want to find out if it's dry eye or if it's a dry eye masquerader. So there's certain tests and things that we do. So when you come in, we always encourage you to bring a list of any medications that you're taking, because the medications, and there are a gamut of them that could be a culprit for underlying dry eye symptoms. Then also we do a very, very thorough history, basically to find out if it is episodic and if those episodes have increased, if it's consistent, what you've already done at home to try to improve things. And then we move into the clinical aspect of it. So we make sure we look at how many tears that you're actually producing. There's ways that we can measure your tears. We also look at the very front surface of the eye. So we put different dyes into the eye that stain and check for different things like inflammation or corneal defects. We put those dyes in the eye. None of them affect the vision. They don't last past those few seconds or minutes, but allows us to illuminate various structures in the eye. Also, we look at your meibomian glands. You heard me a lot talking about glands. There's glands that live in your eyelids, and they contribute to making it oil, which is very important to keep your eyes moisturized. So there's ways that we can look at those glands. We can image those glands to see if they're still there, to see if they're clogged, see if they're functioning. And then we mainly check those glands. So they'll put pressure on your eyelid. I'll flip your eyelid to look at those glands, to look at the oil that's coming out. Then also we have some advanced testing in our office where we're able to go a little bit further to test for inflammation. There's certain markers called MMP9 markers that are present in the tears if there's signs of inflammation in your eye. And we know dry eye has an inflammatory component. So we use a little simple test to be able to test for inflammation. As well as we measure your tears. So there's a litany of different things that we do to go to the next level, just to figure out, one, if the dry eye is episodic, and two, if it is in fact dry eye, or is it a masquerader? Is it something else that's going on that may have some symptoms that are similar to dry eye, but it may not be dry eye itself? And so once we get that litany of tests, I'm able to show you in a big collage matter. We use an Oculus Cartograph 5, so we're able to run those tests within about 15 minutes or so. Then I have everything in front of me, and then you and I sit down and go over all of your results. And it helps me determine a good treatment plan that's going to target the underlying issue at hand.